Well, Doctor, I thank you for your leadership on this issue during the debate of the health care law itself, and right up now on the second anniversary of it being signed into law. And certainly Missouri voters were the first voters that went to the polling place and registered their view of this, which, as I recall, it was like 72% said, no, we don't want to be part of it. Now, the national number on approval appears to be catching up with that. The famous comment that was made on the other side of the building by the speaker, that we'll know what's in the bill once we pass it, has proven to be very true and not very positive from the point of view of that bill. And it was the promises that you and Senator Grassley have talked about already, the promise not to touch Medicare, the promise that if you like what you can have, you can keep it. And surely nobody can say that with a straight face anymore. And the promise that there wouldn't be a mandate during the campaign. You know, 4 years ago, this was the big division between the two principal candidates for the nomination on that side. And Senator Obama's view was that there would be no mandate. There's no need for a mandate. In fact, at one point he said that having a mandate would be like solving homelessness by mandating that everybody buy a house. Now, that's not my quote. That's President Obama's quote when he was Senator Obama. Having a mandate on health care would be like solving the housing problem by saying we're going to require that everybody buy a house. This plan does not work. It doesn't come together. The parts of the plan that were supposed to pay for the plan are one by one being discarded. Remember, Senators, the CLASS Act, the so-called CLASS Act, the Long-Term Care Act, which technically, I guess, would have produced some money because you collected money the first 10 years, the 10 years you're counting the money, and you're not allowed to spend any of it for the first 10 years. So sure, that would be a net income to the federal government. You're not spending anything, everything's coming in. But even the Secretary of Health and Human Services said what many of us said at the time, this plan won't work. So we're not even going to collect the money, because we know that it won't, that there's no way this particular structure will do what it's supposed to do. So it's just one broken promise after another, one set of things that the more the American people look at it, they realize that this just doesn't add up. And not only does it not add up financially, it doesn't add up to better health care. We're going to see lots of people. The Congressional Budget Office recently estimated that I think 20 million people that get insurance now at work would lose that insurance at work once this goes into effect. And that was not a calculation in the original bill. Everybody was calculating at least that anybody who has insurance now their employer would continue to pay for it. Well, 20 million of them apparently that's not going to be the case. And you know, I'd go back to you on that topic of just what employers are going to have to decide to do once they're faced with this new mandated policy that covers not what they think they can afford, but whatever some government official decides is the perfect policy for all Americans. Now imagine that, the perfect policy for all Americans. One size fits all almost always means that one size doesn't fit anybody. But this perfect policy, and these employers, it's now understood, are in many cases just going to take the option. We'll pay the penalty that's less than we're paying now for insurance, and we'll let our employees, we're going to have to require our employees to go get their insurance in a subsidized exchange, which means taxpayers are helping buy insurance for people that today the employers buy insurance for at the rate of at least 20 million, and I think that number will be a lot higher than that. Well, that's exactly what I think we're all hearing. Whether you were for this bill or not, my guess is that you're hearing that if you're asking that question. And you know, the president's promise, another promise, that an average family would, if his health care plan went into effect, would have $2,500 less, as you just said, Doctor, for per year. In fact, since he became president, insurance premiums have risen by $2,213 a year. Not a $2,500 cut, but a $2,213 increase, according to the Kaiser Family Foundation. The survey is that in 2008, employer-provided insurance, the average family premium was $12,860. Last year, it was $15,073. These are incredible increases for families that, along with the bad energy policies and other policies, put families into a condition that they would hope not to be in, and we'd hope not for them not to be in. So you've got increased cost to families, increased cost to the system. That's the other thing the president said. Another broken promise was that this health care bill would control cost. Recently, according to the Medicare actuary, the person that calculates these costs, the estimate was that national health spending would go up at least $311 billion over 10 years under this plan. Now, that's not cost control. That's $311 billion, almost a third of $1 trillion in increases. Payment reductions to hospitals. You mentioned this board that'll make these decisions. I'm not sure that there'll be enough people on that board that understand rural hospitals, to understand why it's critical that rural hospitals that are critical care hospitals continue to have different arrangements with the government than others do for the government-provided health care, like Medicare and Medicaid. And if they understand that, there may not be enough people on the board that understand the unique needs of urban hospitals that have a heavily uninsured population. How is this 15-member board going to be better than the 500 members that serve people in Washington now, of trying to look at specifics and then be accountable? Who's this board accountable to? What decision do they make that somebody can challenge in a meaningful way, in a way that they'd be really concerned about? So it doesn't control cost, as the president said it would. It doesn't reduce insurance costs, as the president said it would. I think it will wind up with maybe even more people uninsured, as long as the penalty that you pay is less than the premiums you're going to pay, particularly for young workers who are outside the system today. In the president's plan, you eliminate the advantage that they have for being young and healthy by saying, no, you can't really classify groups where if you go get life insurance, you certainly pay more if you're 75 for life insurance than if you're 27. If you have, you're just going to pay less. And it's the same way today for health insurance as well, because it's clear that the likelihood of your using that plan at 26 is different than it is at 62. And so all of these things just don't add up, and people are beginning to figure they don't add up. And I thought Senator Grassley made a very good point about, even when we pass the bill, you won't know all of the cost of this bill till it actually goes into effect. And I'm very much in support of his view that we never want to let this get so far down the road we know how much it would really cost, or all of the rules and regulations you would really have, because it will head healthcare in a direction that we might not be able to reverse course and get to a healthcare system that's really focused on patients and healthcare providers, rather than government bureaucrats deciding what's the best health care for everybody. I want my doctor to decide. I want to be part of that discussion. I don't want some government bureaucrat deciding what procedure is the only procedure that's acceptable for me.